Kia koto, everybody. I think we will kick off. Good evening, everybody, and welcome to our live Q&A session with Dr. Shaun Holt today. Now, I hope that wherever you're coming from around the country, that you're nice and warm and snuggled up somewhere. We've had some pretty wily weather out there, so I hope that you're all feeling nice and warm and comfortable. I would like to introduce our wonderful Dr. Shaun. Now, Shaun holds a Pharmacy Nottingham of UK and Medicine, Sheffield, UK degrees, and has conducted over 50 trials and has over 200 publications in medical literature. He is a global expert on the science behind natural products and therapies. He's the author of 10 books, including the bestseller Natural Remedies That Really Work and Medical Cannabis, a brief guide for New Zealanders. So a couple of wonderful books out there. He was a finalist in the 2015 New Zealander of the Year Awards in the Innovator category and a finalist in the 2019 New Zealand Entrepreneur of the Year Award. So absolutely wonderful. As well as that, he has multiple appearances on radio and TV shows. He's given a TEDx talk and appeared on a Netflix documentary. Now, while it is 7 o'clock here at night time, it is actually 8 a.m. in Manchester. So we are thanking Dr. Shaun for the early morning session there. Now, just one thing before we get started, I just want to say that Dr. Shaun won't be providing medical advice or answering questions specific to any individual medical situations. We do all encourage all participants to speak with your doctor or oncology team regarding any personal health and treatment plans. But I think we can get started with our Q&A session. Dr. Shaun, welcome. And look, we really appreciate you coming back again.
My pleasure. Good evening. Thanks for asking me back.
Fantastic. So Shaun, you happy for us to kick straight into our questions?
Go for it.
Wonderful. Okay, so first question we've got here is to begin. So could you explain what are complementary therapies or CTs and how they might fit alongside conventional cancer treatment?
Sure. So conventional therapies, we all know, are things like chemotherapy, radiation, surgery, things that you get in the hospital. So complementary therapies work alongside these, hence the name. And so the confusion can be that some complementary therapies have now become part of standard practice in the hospital, which is great, and I'm sure we'll cover some of those. But the three features really tend to be that they're mostly natural. They are often holistic, meaning focusing on the whole person, the body, the mind, the spirit, not just the disease and the symptoms. But importantly, they're not going to cure anyone's condition. They're there to support people, help with quality of life and help with symptoms. So they complement standard treatment.
Sure. And so complementary therapies have sometimes been thought of as an alternative treatment. Is there a difference?
Yeah, a huge difference. And they're quite similar terms. I understand why people might be confused. But alternative therapies tends to mean when people stop using the traditional treatments from the doctor, from the hospital, from the oncologist, and instead use these other, natural holistic treatments instead of, which of course, I wouldn't recommend at all. I would always use them alongside with. So as a complementary therapy, alternative makes me worry that people are going to stop proven treatments.
Sure, yeah. So a lot of people might be skeptical or confused about complementary therapies. What's one common myth or understanding that you encounter, and how would you respond to it?
Sure. Well, I'll give you a couple, actually. I mean, one is that I've just alluded to, that they can cure cancer. Now, unfortunately, I don't think there's a cure for cancer, in the complementary therapy world. Maybe in the future, maybe some of the things people are trying now, the studies will be done and they'll be found to be a cure for cancer. That, that's fantastic. There'll be no one happier than me. But at the moment, they're not there for a cure. People, I don't think, should be looking for a cure, but to help themselves in terms of symptoms. Another massive fallacy I see all the time, and I understand why, it's natural to feel this way, and that is we often think if something is good, then a really, really big dose of something is going to be really, really good. And unfortunately, I can't think of any examples where that's true. In fact, just the opposite. Usually, say it's a vitamin, say, I don't know, vitamin D, for example, we all need probably some more vitamin D, but having a massive dose of vitamin D is almost likely going to be harmful. So that's two of the fallacies I see all the time.
Yeah, sure. Can complementary therapies be grouped into key areas like nutrition, physical activity, and mental well-being? Does research support the benefits of using a combination of them?
Yeah, so there are hundreds and hundreds of complementary therapies. And I think I said this last time that every time I talk about the subject, someone will mention something to me I've never even heard of before,
Sure.
even though I sort of do this all the time. I think that happened on the last session as well. And that's fine. They're coming along all the time. They've been invented, they're being discovered. So there's hundreds and hundreds. But I think a really great way to think about them is there's a semi-official grouping, if you like, into 5 different categories. And that's the way I think about them. So those categories are, the first one will be alternative medical systems. So very different to the way we think about medicine and health in the Western world. So this could be Chinese traditional medicine, Indian traditional medicine, even something like homeopathy or acupuncture, things that don't fit in at all with standard medicine. The second would be mind-body interventions, where there's nothing physically done to the body. So this could be something like meditation or hypnosis, for example. The third group would be where the body is physically manipulated in some ways, like massage therapy or chiropractors. The fourth group, probably the biggest, is what we call biological, where you take something into your body. So that could be a vitamin, a supplement, a different diet, a drink, etc. And the fifth one would be forms of energy, such as light energy, for example. So that's a good way to break them down into all the many, many ones out there. And one thing I really love about complementary therapies is there's different things for different people there. So some people might want a pill, some people might want to do something more physical like exercise, some people might want to do something more spiritual like meditation. And so you can pick and choose whatever you want. Or to answer your second part of your question, you can have a combination of these. And in fact, a lot of people will have lots of these. I understand why. A lot of people want to maximize their health as much as possible by using everything that's out there. So a lot of people will use a lot of different things. You specifically asked, does research support a combination of these? Not really, in that I can't think of many studies where they've tried, 5 different complementary therapies in the same study. However, common sense and basic science says that these things are going to work together to get maximum benefit. There'd be no reason why not.
Sure. And this sort of leads us on to our next question is, how do complementary therapies work alongside traditional medicine? What role do they play in an overall treatment plan for someone with cancer? So I guess it's just elaborating on what you've...
Yep. So, in my view, even though this is my field, I think whatever comes from the doctor, the hospital, the oncologist is the most important, to follow those. It's always based on the best evidence. But then, as you said, the complementary therapies play a supportive role, helping with symptoms, quality of life, and fit in, and they can fit in nicely. There's no reason why they can't fit in nicely as well. So I think these days most people are using some form of complementary therapy, even if it's just taking extra vitamins or doing more exercise. And what's nice is, I've been doing this for 20 years now, and I'm seeing them becoming more and more entwined, and a lot of complementary therapies becoming part of mainstream medical practice. An example would be massage therapy. Everyone likes a massage, but now, oncology centers are offering this as a service because they know it's valuable for a lot of people.
Sure. So is it important for cancer patients to talk to their clinical team before starting any complementary therapies? Why or why not?
It's important to keep the team informed, absolutely. I think if it's something relatively minor, like a little bit of exercise or yoga or, a multivitamin tablet or a fish oil, you probably don't need to tell them really before you start, maybe just keep them informed. If it's something more involved, like, some sort of herbal treatment that if you look it up has lots of side effects, then it'd be good to discuss it before you start as well. And just on side effects, one of the many questions is about interactions. and I wear both hats. I'm a pharmacist and a doctor, so I can say this without upsetting anyone, is that pharmacists, I think, are far better source of information on side effects and interactions of vitamins and supplements and minerals, etc. And doctors, we're probably going to have to look it up. The pharmacists will probably know. Uh,
Sure.
and also in terms of keeping the team informed, again, over the last 20 years, what I've seen is a real change in attitude, particularly amongst hospital doctors, going really from quite against a lot of this and dismissing
Mm.
them and saying it's all nonsense and don't waste your time, to now, all the ones I speak to, to be very, very receptive on the whole.
Right. So, how can complementary therapies specifically help someone going through cancer treatment? What are the benefits? And do you think carers or family members can benefit from them too?
Yeah, I mean that's a big question. So many potential benefits. So I think really someone with cancer, one would be symptoms of the disease itself, and there can be so many different ones. Whether it's low energy, pain, quality of life. Whatever the issue is, there's generally answers in the complementary therapy world for these issues, and we'll get into some of these later. But another important thing is, cancer treatments can be very effective, of course, standard ones, but they can bring with them a lot of side effects. It's just the nature of the beast. Things are
Mm.
getting better all the time. There's so many clinical trials ongoing every year, and cancer treatments get a little bit better every year. They're getting more effective. We're getting less side effects, but it is just a small amount gradually over time. There can be a lot of side effects. Obviously nausea from chemotherapy. We all know about that. And that's another one where complementary therapies can come in. And as you mentioned, family members, yes,
Mm.
so often not quite as thought about as much, but there can be a lot of stress in particular for family members and friends supporting people with cancer. And again, lots and lots of solutions in the complementary therapy world. And I did mention stress there. That's one of my hobby horses. Not something really doctors think too much about, to be honest, is stress. Maybe in cardiac patients, they might think about it a little bit, but they probably won't have a great many answers in the medical world. But there's so much for stress in the complementary therapy world. And the reason I get so interested in it is because stress is so bad for our health. We're all stressed these days. So if you've got a bad illness or someone else has, you're going to get even more stressed. And stress puts up your heart rate, your respiratory rate, your blood pressure, which has a massive toll on the body. Exactly at the time you don't want that. You want your body to be fighting disease. So that's why I say something which a lot of doctors may be skeptical of, like let's just say aromatherapy. And they may say that's not a proper medical treatment. And I would disagree because I've seen the studies showing how it can help so many people with stress and bring down that blood pressure and that respiratory rate. And so for me, that's a really important part of health.
Yeah, sure. So we hear a lot about the importance of evidence-based medicine. Is there research that supports the use of complementary therapies in cancer care, and how are these therapies studied or proven effective?
Yep. So there are millions of clinical trials going on around the world. In fact, you can actually look them up. There's a website. It's called clinicaltrials.gov. You can see every single trial that's going on the world. They all have to be registered. And as I said just a few minutes ago, that's how new cancer treatments are invented, or the current regimes are, tweaked to make them better. So that's how we study any medical intervention is a clinical trial. I spent most of my career doing clinical trials. And yes, there's been many, many clinical trials on complementary therapies, and lots of them also in people with cancer as well. So when I make recommendations, it's based on a few things. It's based on the basic science. Does it make sense that something would work? But ideally, it's based on the clinical trials. Has there been clinical trials? What do they show in terms of safety and efficacy? Unfortunately, I wish there were lots more clinical trials to make decisions on. So some things, just haven't really been studied enough, and that's the way it is. There are far fewer clinical studies of complementary therapies than pharmaceuticals,
Yeah.
and that's mostly a matter of funding. Clinical research does cost a lot of money because it takes a lot of time and expertise. So it costs money, and pharmaceutical companies can afford to do the trials and can get the return down the line later. So There's not much, nowhere near as many in the complementary therapy field. But the good news is that there's plenty to make a whole range of really solid recommendations that I think would cover most issues people will come up with. And in fact, there's enough for a whole book on the subject. As you know, I've written a little book on the subject.
Yes, absolutely. So now, while complementary therapies can be helpful, are there any that you would recommend maybe with caution, or perhaps avoid altogether? So what should people be wary of?
Yeah, so this is a little bit of a fallacy in the complementary therapy world, and I do upset some people at some times, because some people believe all natural things, all complementary therapies are wonderful. Unfortunately, that's not the case. Some are, of course, and I just, there's no bigger proponents of some of them than myself, but there are some really that I don't recommend, and there's some that I actively advise against. And it's based on two things. One is effectiveness, and the big one is safety. So
Sure.
if something's not effective, but it's safe, it's not going to harm you, but you're sort of wasting your time, you're wasting your money, and you're wasting an opportunity to use something that will work as well. So at the milder end of the range is something, and again, I don't like saying this, I know it upsets some people, would be home, because some people will be taking it. Now, if you're using this, don't attack me, continue taking it. That's fine. You can do whatever you want. But homeopathy, for example, I'm on record talking about homeopathy. There's no clinical studies showing that it works. The theory doesn't make sense to a Western point of view, where things are diluted so much that there's really nothing there. In my view, it's a placebo, and that's fine. If people want to take it, take homeopathy. It's not going to harm you. If you believe in it and you think I'm talking rubbish, I have no problem with that. You continue. So that's one where I'd say there's the evidence is lacking in terms of science. There's others where they're really good, but you just got to be a bit cautious, because they can have effects that are unwanted. So an example would be St. John's wort for depression, which is a herbal treatment, really, really effective for a lot of people for depression, arguably better than antidepressants, with sort of the same effectiveness and fewer side effects. In Germany, for example, the doctors prescribe St. John's wort rather than antidepressants on the whole. So St. John's wort, fantastic, but it can have a lot of side effects, like a medicine. It can have a lot of drug interactions with other things. So just be careful. Tell your health practitioner, don't avoid it, but just don't take it and not think about it. Give a bit of thought and get a bit of advice on it. Then the far end of the range is things to actively avoid, and these are ones that are dangerous. And unfortunately, these happen. They come around. One of the best examples, or worst examples, if you like, in New Zealand would be something called miracle mineral solution. I don't know if anyone's seen this. If you Google me, you'll see me talking about this lots. And for some reason, it's very popular in New Zealand. It keeps coming back, and it's a drink which is basically strong bleach. And people are told to drink this strong bleach. They're told to drink it as a cure for cancer. And it's, as you don't need me, a doctor, to tell you that's not a good thing to do. Again, I don't blame anyone who tries this, who believes the hype and can be desperate. People can be desperate for solutions. But it keeps coming back in New Zealand. The authorities I haven't seen it for a while, thank goodness, but authorities, they're often slow, but they get rid of it, and then it tends to come back. But for a good 15 years now, I've been warning against miracle mineral solution. Clearly very dangerous. So there's some of the ones to be cautious with, and maybe some to avoid totally.
Sure. Thank you for that. So if you had to choose, what would be your top three that you'd recommend for cancer patients, and why do you think they're so effective?
Well, yeah, I actually have this in when I give lectures. I do have a top three, so I do have that ready for you. So just my favorite subjects really in the whole of the complementary therapy field. Just these have come really when I've been reading a study, and I thought, wow, that is incredible. And actually, all three of these, I think we should be using a lot more. And that's one of my little jobs, is to try and get doctors to use some of these more. So the first one would be omega-3 fish oil, which is great for so many things. I mean, I give whole lectures. I've written a whole book on fish oil and how wonderful it is. And fish oil for depression and for mood. And the study I'm thinking about, people with severe depression, they were given either high dose fish oil. I mean, that means 6 standard capsules a day of fish
Wow.
oil. Yeah, compared to fluoxetine, Prozac, one of the standard drugs. And lo and behold, the fish oil was better. You know,
Wow.
that's an incredible finding, which I think few people knew. It was a great study. In fact, the best result was from both, actually, the antidepressants and the fish oil. But regardless, you know, we don't really think of omega-3 for that thing. We think about it for the heart, don't we? And bringing down your
Mm.
cholesterol. So one of the many wonders of omega-3. Uh, Another one I love, which is because it used to be an old wives' tale, really, which is ginger for nausea. You know, we've all heard about ginger for nausea forever, but it's true. And it was studied. There was a study in an oncology center in America, about 600 people, and they worked out that it was just as good as the strongest anti-nausea drugs that the hospital could give you. It was just as good. Um, Also, really importantly, they worked out the dose, and that's really important, as I said right at the start. So they worked out the exact dose. And the exact dose, by the way, is 0.5 gram a day. 0.5 gram a day of ground ginger, which is quite a lot, either in one go or spread over 24 hours, gives you the maximum anti-nausea effect. Um, and because if you have more than that, you can run into side effects, you know, and people think, well, how can even ginger give you side effects? But it can. So it can thin the blood, for example, which might be important going to surgery. Um, then the final one, I quote this often, and this was a study in children with leukemia who were having to have regular what's called a bone marrow aspiration, which is a massive needle into the hip. So it's horrible, you know, it's quite horrible, very, very painful. And, you know, for the children, you know, you can imagine that would be one of the worst things for them to worry about, having this and then knowing that in the future, regularly they're going to have this horrible thing that, you know, they hated it. So in the study, what they did around the time of the aspiration, they did hypnotherapy.
Oh, wow.
And what happened in a lot of cases is the children then forgot about it, and they didn't spend the next weeks, you know, worried and petrified about this really painful procedure. So you can imagine what an amazing difference this would make to their overall quality of life. So I think that's a fantastic study as well. Even Sorry, just to digress for a second, I do digress. And the thing is, we don't know how hypnotherapy works. No one knows how it works. It clearly works for some people. And this is one of the several ways I sort of differ to some of my medical doctor colleagues, in that often they'll demand, you know, massive, massive studies and, you know, what is the mechanism of action? How exactly does this work? And if I don't know, then I'm not going to recommend it. You know, I still hear that quite a lot. Whereas for me, I sort of don't care. If something's safe and it works, or it's probably going to work and it's worth trying, then that's fine for me. We can worry about mechanism down the line. I'd rather just help people.
Sure. Wonderful. So just to regroup there, so our Dr. Shaun's top three is omega fish oils, ginger, and hypnotherapy. So very good. Wonderful advice there. Now, Dr. Shaun, we're going to move on now to our pre-submitted questions. So these have come in. Thank you very much, everyone who sent questions in beforehand. So the first one here, we've got what interacts with aromatase inhibitors? What reduces the side effects of letrozole? I use large doses of fish oil. It appears to be working. Could this all be in my head? But even if it is, if this is the case, I will take it as a win.
Yep, so quite a few questions there. That's fine. So in terms of just general terms, side effects, as I said, you know, I think pharmacists are really, really good on this, and you know, what can cause them, how to help them. And another great source of information, by the way, is a website. It's free and it's called WebMD. I don't know if people have heard of this one, because there's a lot of rubbish on the internet, of course, but this is a great free, high quality website, WebMD, WEBMD.com. So for questions like this, it's a really good source of information. So yeah, aromatase inhibitors, you know, for cancer can be very effective, but you know, have a lot of interactions with other medicines, like antidepressants, for example, or a lot of herbal treatments, blood pressure treatments, pain treatments, a lot of interactions because of the way they work. So really important to seek advice on those. And a lot of side effects, you know, unfortunately, some medicines have a lot of side effects. bone pain, joint pain, weight gain, sleepiness, insomnia. I mean, there is a big list, unfortunately, with this class of drugs. But the good news is whatever the side effects are there, and I can't go through all of them, but there's likely to be things in the natural world that can help, for sure, that can help with pain, for sleepiness. I list them in the book, and if people have got any specific questions, we can answer those. Now, I think the person here has tried fish oil,
Mm.
and that's great. So, as I just said, I'm a great fan of fish oil. Um, it has anti-inflammatory effects. That's probably how it's doing everything it does. And it does so much, for the heart, for the brain, for you name it, for joints, for pain. It's probably working by reducing inflammation. I'm not surprised that the person here has found some benefits from the fish oil. I think, it would have been one of my first suggestions anyway. Um, so, so yeah, by all means, carry on. That's a great example, actually, of what we talked about, a complementary therapy. I've got side effects from this treatment. The fish oil's helping with them. Fantastic. You're probably also getting other benefits from the fish oil, which is great. It'll probably also be helping your heart and your blood pressure and your cholesterol, as added little bonuses. Now,
Sure.
just to digress, well, no, actually, to answer the question. So I'm taking large doses. So for me, a large dose is 6 a day. And I certainly wouldn't go over 6 a day. And they can be quite difficult to take. They're often big capsules, so take plenty of water. So if you're treating a condition like you're treating depression, treating heart disease, treating inflamed joints, actually 6 a day is a great dose. Um, if you're just taking them as a general supplement for general health, which I think is a good thing for everyone to do anyway, that's what I certainly do myself, then a dose would be 2 a day. So
Right.
that's your doses really. 2 a day is standard, but if you really want to get on top of something, 6 a day. Just to slightly confuse it, because 6 is a lot. There are quite a lot of products that are double strength, and it's quite clear on
Right.
the label because a fish oil capsule is a standard strength, and some people do a double one in the same size. So if you have the double one, of course, you can have half the number. So if you're having the double strength ones like I do, just have 1 a day as a good supplement, or 3 a day for a high dose to get on top of things.
Okay, that makes sense. Is that a milligram amount, or what is that? A single
Yeah,
dose?
without going too much into it. So a standard capsule of fish oil is 1,000 milligrams.
Yeah.
And in there's a set amount of DHA and EPA, usually 300 milligrams. So it's a very specific thing that is a standard fish oil capsule.
Okay, great. Excellent. So our next question here, we've got, in your opinion, what are the benefits of adjuvant chemotherapy over healthy lifestyle and complementary therapies?
So adjuvant chemotherapies, a conventional medical treatment, they could be proven to reduce, the chance of cancer recurrence. So, as I've said several times, that's what the doctors, the hospital recommend. I strongly advise it. But again, it's not an either or. In my view, if at all possible, have a healthy lifestyle and use complementary therapies as well. I'm just such a firm believer that the stronger the body is, the better position it's in, to fight cancer, to prevent cancer reoccurrence. So, in terms of healthy lifestyle, it's the things we all know. It's the things we all know. It's diet and exercise, less stress, good sleep, all those things. And then if there's any specific issues, complementary therapies, or even if you allow me to digress again to another hobby horse, even if you have no specific issues, I'm a strong believer in taking a multivitamin every day.
Sure.
If I can't see all the crowd on the call today, unfortunately, but if we're in a lecture theatre, I'd say put your hand up if you take a multivitamin, and usually about half of people do. But I think a multivitamin for everyone, particularly someone with a diagnosis, is really well worth taking. And just to be clear, this is my view. That wouldn't be the view of many doctors, although some are coming around.
Mm.
What most doctors would say is that no, eat healthy, and you don't need a multivitamin. It's a waste of time. It's a waste of money. You're going to pee it out. That's what a lot would say. I would disagree, because if in a multivitamin, there's about a good one, there's about 40 different things. all your vitamins, your minerals, and generally most of us are low in a few things. We just are. Even if
Sure.
you try and eat healthy, we all have our favorite things, and we have more of this and less of that. You're bound to be a bit low in something. You could be low in manganese or biotin or vitamin B5. How would you know?
Mm.
Um, or say in New Zealand, most of us are low in selenium because it's
Yeah.
not in the soil as much. We're mostly low in selenium. Vitamin D, most people are low, particularly in the winter, and you'll get that from a multivitamin. So um, I think of a multivitamin as insurance. Some people call it nutritional insurance. So in my view, if you take a multivitamin, about 40 things in there, about half the recommended daily intake of each one, roughly, you're getting a bit of a top up of everything, and you're highly unlikely then to be deficient in anything. So you can just relax. It's not
Mm.
impossible, of course. You might still be deficient in something if you have a specific need, but if you have one, it's a minimal cost. It's such a small cost to have a multivitamin. You don't need the most fancy pants, men's over 50 but below 52 formula that they sell for
Mm.
double the price. Just a good
Yeah.
multivitamin from a reputable company, for a few cents a day. There's going to be no side effects at all. There can only be benefits. So that's sort of related to the question. I think,
Mm. Mm.
personally, a probiotic, I think a fish oil is great. Sorry, a multivitamin, a fish oil is great. And then I won't have time to get into it now, but anything sort of bowel related at all,
Oh,
then, probiotics can be really good as well. They can be good for everyone.
wonderful. Fantastic. Okay, next question here. What are your thoughts on the metabolic approach to cancer treatment using a ketogenic diet alongside conventional therapies? And then the second part is also the effects of fasting. Is there any evidence of their efficacy?
Yeah, it's sort of the same thing, really. In some
Mm.
ways, it's trying to starve cancer of energy. So, this has been building momentum for about 5 or 10 years now. Now, I probably won't be popular. We're saying, unfortunately, I don't think it's helpful. Um, um, there's a few studies in mice that have been promising, so that's great. So, for me, I've got to wait and see what the studies say. Yeah, so there are some ongoing in people. The theory, is that cancer cells divide quickly. They need a lot of energy, and that's actually how some chemotherapy and other treatments work. They hook onto this fact and work on
Mm.
this fact that cancer cells, they're dividing quickly, need a lot of energy. So, I can see the logic. Oh, well, let's starve them and kill them or stop them growing. But the problem is, I don't know how you can do that without starving your own body's cells of energy. And I think you need the energy. Your body needs energy to be healthy and to fight the cancer. So I personally think it would do more harm than good, because I think you're going to be harming your own body and its ability to fight it more than you'll affect the cancer, which has other ways to get the energy. So, as I say, often, I hope I'm wrong. I hope I'm sitting here in 3 years' time recommending this to everyone because the studies are in. But I can only say what I would do myself or what I'd recommend to others to do, and that is I wouldn't do this.
May have froze on us, Shaun, Dr. Shaun, for a minute there.
Oh, am I back?
You are back. Yes, thank you.
Where did I cut out?
You just said that what you wouldn't do
Yeah,
about
yeah. So all I can
starving. Yeah.
say, I know it's not a popular answer, unfortunately. People really do want something amazing. I don't have that. But I can say, at the moment, I think in my view, the balance of evidence is there's going to be slightly more harm than good from doing this. But I hope I'm wrong in the future.
Okay, thank you very much. Now, next question here. Can we have elderflower drinks or medicine?
Yeah, absolutely. It's quite mild, it's a traditional medicine. There's antiseptic properties if you apply it topically, anti-inflammatory properties if you drink it or have it in a capsule. People take it for colds and flus. That's important to get on top of those. There's a little bit of evidence for that. So it's generally considered safe. The only thing with it is it is known to lower blood sugar levels. So, obviously people with diabetes just use it with caution. But there hasn't been a lot of research in it, to be honest, but it is quite mild, just the blood sugar thing to look out for.
Okay, great. Would you focus on a combination of recommended food groups and vitamins to help boost one's hemoglobin, or just food alone? And do you have a standard reset therapy to boost blood markers following the end of chemotherapy?
Right. So yeah, I mean, low iron, low hemoglobin, anemia, a common problem with people with cancer from the disease and from the treatments, of course. Really, I think it's an area for the hospital to manage on the whole.
Sure.
So if you need something from them, they'll give it to you. Even it could be a blood transfusion, or it could be a certain medicine. And if it is low, I'm sure they will recommend to have food and to have supplements as well. So I'd definitely work with them on that. The thing is, apart from the blood transfusion, it doesn't generally come up, straight away. It's a little bit of a slow process. So, and also you can only absorb certain much every day. So there's no point having massive doses in your
Right.
food or as supplements. So, but yeah, if you're low, of course, have iron-rich foods, plenty of red meat if you're not vegan, leafy greens, beans, cereals, wherever the iron is, and supplements as well. You may need B12 and folic acid supplements to help with the absorption, but yeah, definitely work with your hospital on that, and don't expect massive results immediately. And as I always say, don't have too much, because you can quickly run into problems with too much iron, as you can with anything.
Right. Okay, great. Next question here. I recently saw a post on social media claiming that green tea or matcha can kill cancer cells. Is there scientific evidence to support this? Can regularly consuming green tea or matcha tea generally help in fighting cancer?
So unfortunately, I see this a lot. So what I haven't seen the specific study, but what would have happened is that they've got in a test tube, got cancer cells and added the things, and it's killed them. It's, oh great, we've got a treatment for cancer. Unfortunately, just about everything would kill cancer cells in a test tube. It doesn't mean they're going to help you as into your body, unfortunately. So no, I mean, this isn't a miracle cure for cancer at all. Just to slightly complicate, can regular consumption help? Yes, because green tea is full of antioxidants. So green tea is like black tea, but it's not oxidized. So you got a lot more antioxidants in there. And yes, in general, antioxidants can help prevent cancer, overall in the population generally. Antioxidants are good. That's one of the things they do. So it's certainly not a cancer cure at all, but it's certainly a very healthy drink, and coupled with a healthy lifestyle and a great diet, as part of that, could, for some people, prevent cancer or recurrence.
Sure. Okay, great. A naturopath once recommended that I take 5 vitamin D tablets daily to support my immune system. Is it safe to take that amount of vitamin D each day, and does it truly offer immune system benefits?
Right. So that sounds high, apart from fish oil, just because of the nature of that, you have to have large number of capsules often. That sounds high, but I'd have to see the bottle, how much is in each one. But that does sound high to me, so I'd be cautious. But yes, it does support the immune system for sure. So what do we mean by supporting the immune system? There's no test for immune system. I think most people think it's getting lots of bugs and infections and coughs and colds. Generally, that's what people think of. And yes, vitamin D definitely reduces the number of respiratory infections we get in the winter. So it's definitely, if you suffer from them, if you have asthma or other respiratory conditions, that'll make you more prone to respiratory infection. So it's a good idea. So yeah, a lot of GPs now will prescribe vitamin D, particularly in the winter, to
Sure.
reduce respiratory infections, and also for mood. I mean, that's the other big one, of course. A lot of people get low mood in the winter with the lack of sunshine, and vitamin D can be useful for that. So yeah, most of us are low in vitamin D in the winter. Just while we're on vitamin D, people don't realize you need it in your diet. So that can be from a supplement, a multivitamin, but of course, your regular diet, so dairy products in particular. But you also need sunshine as well, because the sunshine on the skin activates it. So you need both. And unless you have both, you're going to have low levels of vitamin D. Now, obviously, there's a lot less sunshine in the winter, but also, health advisory organizations have struggled with the message, because the stop skin cancer message has been hammered home,
Mhm.
and rightly so,
Mhm.
to the point where we don't get any sunshine at all sometimes, and then that can have negative effects because of you're not going to have enough vitamin D then. So in
Sure.
general terms, personally, when I'm, a wonderful summer's day, I'll have, I think after 3 o'clock, you're highly unlikely to burn yourself, but you'll still get lots of good UV radiation. So it's a balancing act, don't avoid the sun altogether because, vitamin D is critical for your health. Every cell in the body has vitamin D receptors. It affects every body system, including infections and the mood, as we've said. So yeah, you need some in your diet and you need a bit of sunshine. Well, not even sunshine, you need some UV. So even a cloudy day in winter, if you're outside for an hour, you'll still get actually some sun rays coming through. You'll be surprised to get your vitamin D levels. So 5 a day sounds high. Just again, I would actually look it up on that website I said, or take it to your pharmacist, because vitamin D chemistry is complicated and there's different products out there. So, but a pharmacist can tell you 5 is the correct amount, but you don't want to overdose on it.
Yeah, sure. Now, that takes us to the end of our questions that have come through by email before the session. So what we're going to do is go to our little chat box now.
Sure.
If anybody's looking there, we've got the website webmd.com in there. So if you'd like to copy that down, that would be really good. Our next question here is, I'm using hemp oil, which is high in omega-3. Does this compare with fish oil?
Well, not yes and no. So there is some omega-3 in hemp oil, which is great. Not as much as in fish oil. So that's the answer. So you can get some, but you'll just have to have more. That's all. So you'd have to look up how much of those. If it's a product you bought from a shop, it should hopefully say on the label how much of the EPA and DHA is in there. And then if you look up a standard fish oil and do a comparison, you might have to have double, for example. If it's something that someone's made, you might not know how much in there, and that's fine. So there's not as much, you just have to have a bit more is the answer. But hemp oil, though, is a good alternative for a few people. So vegans, of course. So some vegans won't have fish oil. People who don't. The other is some people don't like the side effects of omega-3 capsules. You can have fish repeating on you. The big capsules, some people can't handle them. They're big. Just to answer those two things, if you're finding them too big, just loads of water, just a massive amount really washes them down. If you're getting the fishy burpy after effects with food. Absolutely have them with food. That will stop that to a large degree. And an empty stomach, you're going to get that, and even some stomach irritation. So that's if you want to use a standard omega-3. If you want a vegan one, or you want something that's not a fish oil capsule, hemp oil's a good option. Actually, but what I think is another great option people don't realize is algal oil. Algae, the microalgae from the sea, algal oil, ALGAL. And the reason that's a good option, it's a bit more expensive, unfortunately. The reason it's a good option is because actually all the omega-3 in the fish comes from the algae. The fish eat the algae, and then the omega-3 in the algae has never been near a fish, so there's no fishy aroma to it. It doesn't taste of anything. So you can get a lovely liquid, or probably a capsule these days, that's not been near a fish.
Okay, that's really good to know. Next question here. So aside from WebMD, how else do you work out which particular treatments might be good for specific side effects?
Yeah. WebMD, you could ask a knowledgeable practitioner around, a good pharmacist with an interest in this, or a doctor or GP with interest in this would help as well. And then I guess there's other reputable websites as well. So I'll just give you one more, and that would be the Mayo Clinic. The Mayo Clinic that you've heard of. I'm fortunate I've actually been there and lectured there on this subject. So they have a great website as well on complementary therapies. They'll give you good advice. Also, my book on the subject, which you can get from a lot of libraries in New Zealand, or from the organization itself. I list all the major side effects as well, and which side effects the treatments can be helpful in treating. So there's a few good sources of information out there.
Fantastic. Also, is there any evidence on the role of CT, complementary therapies, in reducing the risk of or reoccurrence, e.g. not to help with managing side effects or quality of life?
Yeah, there's a little. It's not proven beyond doubt at all, and it's really really hard to prove this because you need massive studies, and there's so much going on. You know, how do you know it's the complementary therapy that helps? But the best evidence I've seen is from the two I mentioned before, the key two, so multivitamins and fish oil. You know, there's some pretty decent evidence there, but absolutely not proven. I must stress that. But you know, there's hints in the data that there seems to be less recurrence if you have those. Now, that could be because people are generally healthier, and it's hard to work it out, but there's certainly no harm from taking those. There was a study earlier this year, it could have been last year, on the Mediterranean diet, and that's probably actually the most compelling I've seen. That showed less, you know, lower chance of recurrence if you follow the Mediterranean diet, which of course is full of omega-3 and other things as well, and
Sure.
is generally a healthy diet and helps with your heart and other things. So nothing proven, but I think Mediterranean diet, omega-3 multivitamins, and generally being as healthy as you can is the best thing you can do.
Wonderful. We've got one last one here. What is your opinion on soursop?
Oh, it's the last question, and it's again, I said up front, there's always something I don't know. I'm sorry, I
Right.
just haven't come across it. I just haven't come across it. There's always one, isn't there? So I'll
Yes.
look it up myself when we're finished, but I'm afraid I don't know.
No, absolutely. No problem. Dr. Shaun's put in, or Look Good Feel Better's put in there the Mayo Clinic website as well for anybody that wants to jot that down. Now, we'll just do a little quick around the room if there's anybody that would like to ask a question that they haven't been able to put in the chat. If you'd like to ask a question, we've got a moment or two just to take some more questions. Not seeing any hands up there. No, I don't think it might be time to be able to let you go. Look, Dr. Shaun, it's been absolutely wonderful. I know having you on the call last time, and you covered a lot of this stuff, and it's been wonderful to have you back again and reinforce what you've talked about last time, and also being able to address everybody's questions as they've come in as well. So we really appreciate it. Thank you for working out that time zone thing, and I know it's relatively early for you, but yeah, we do appreciate it, and we'll look out for your work in the future. So round of applause for you, Dr. Shaun. Thank you very much.